Big news coming at the top of this hour. COVID-19 claims yet another life in India. 62-year-old man dies of COVID-19 in Kashmir. So this is the big news that is coming in now, that COVID-19 has claimed yet another life in India, and a 62-year-old man from Kashmir dies of COVID-19. The death toll has increased in India now, and over 23 deaths have been reported so far. And COVID-19 has claimed yet another life in India, where a 62-year-old man who had tested positive has died in Kashmir. So COVID-19 has claimed yet another life in India, and a 62-year-old man has died of COVID-19 in Kashmir. And a lot of cases has come in from Kashmir, where people have tested positive, and the death toll is only increasing in Kashmir now, with yet another death reported from the state, with a 62-year-old man who has died due to COVID-19. Some more disturbing news coming in now. 45-year-old man dies due to COVID-19 in Ahmedabad, Gujarat. The number of total positive COVID-19 cases in Gujarat rises to, total number of deaths rises to 5 in Gujarat. So now a 45-year-old man dies due to COVID-19 in Ahmedabad. Total number of deaths rises to 5 in Gujarat. So this is the big news coming in. COVID-19 claims yet another life in India. So now a 45-year-old man dies due to COVID-19 in Ahmedabad. Total number of deaths rises to 5 in Gujarat. So this is the big news coming in. COVID-19 claims yet another life in India. Looking at the spike in the number of cases, there has been a steep spike in the last days, and the exponential curve is only rising as the days go by for India too. And this is something which is definitely worrying all the citizens as well as the authorities too, because despite their best efforts, they are still not being able to bring this under control. For more on this, I'm also joined in by my colleague Pratibha. So Pratibha, going ahead and giving an overview about the deaths that has been reported today from across India, as well as the number of positive cases too. India has seen a steep spike in the number of cases which is on the rise.
That's right, Prajwal. The day has not started on a very good note today. We are seeing the number of cases in the country increasing. Now, 2 more deaths being reported in the country. As of now, details on the travel history of these patients is not known yet. Very sketchy details that are just coming in. But we do know that both these patients had comorbid issues. Like we've mentioned time and again, that the patients who already have pre-existing medical conditions are at a greater risk of not just contracting coronavirus or COVID-19, but also the fatality rate increases because of these coexisting medical issues. So in these 2 patients as well, that was the case. The numbers continue to rise. The number of people who have been infected in the country also have risen. We'll put out the numbers as well across the country. What are the figures as they stand as of now? Throughout the country, 21 deaths have been reported. Very disturbing, and you know, it's very saddening to know the 21 deaths have taken place, but the number of those who have been infected could rise as well. And before we delve further into it, also wanting to give out the message that tests are being conducted now, more number of tests being conducted, which is why the numbers are going to rise. But if we continue to follow the lockdown, then the numbers can be contained. These are the numbers. Let's take a look. In Karnataka, as of now, there are 81 active cases, out of which 5 have been cured. The total number of deaths in Karnataka is 3. In Andhra Pradesh, no deaths being reported, 14 active cases and 1 person cured. In Bihar, 9 cases and the total number of deaths being 1. So these are the numbers coming in from the different states, and as the number of testing has increased, the number of positive cases might also increase, but that should not be a case of alarm, but that should be something that should give out the numbers, because if more testing is conducted, it would also give a clearer picture on the number of people who have been infected. This also means that they would have access to more medical facilities. So in Chandigarh, 8 cases have been reported as of now. In Chhattisgarh, 6 cases being reported. In Delhi as well, the number of cases being reported is 39, out of which 6 have been been cured completely. Now, in Goa, the total number of active cases being 3. In Gujarat as well, it is quite high, 45 people. The number of deaths in Gujarat also being quite high, 5 people have died in the state. In Haryana, the total number of active cases being 33, while 12 have been cured. In Himachal Pradesh as well, 3 active cases. The number of testing has been increased in Himachal Pradesh as well to give a better picture of the number of people who might have been infected. In Jammu and Kashmir, 22 deaths, the second death being reported just this morning. In Ladakh as well, 13 people have been infected. So these are the numbers as of 5:45 p.m. In Kerala, the total number of cases is quite high. In Maharashtra as well, these are the 2 worst affected states in the country, but the number of tests being conducted in these states are also exponentially high, which is why it has increased. 7 new cases have been reported from Maharashtra. So taking the numbers further, as of now, as of 5:45 p.m., it was 187. The total number of cases would also increase. In Madhya Pradesh, 30 cases being reported as well. As of now, Karnataka is the third worst affected state in the country with the number of cases that have been reported as of now. The health officials are working round the clock to ensure they reach out to more and more people who have come in contact with the patients who have tested positive. These numbers will continue to roll on your screens from each of the states, the number of people who have been infected. A few of the states were worse affected than the others, but like we've been mentioning, this pandemic is going to hit the states in waves, which means it's not going to be equal in all the states at once. It is going to hit each of these states at different paces, at different levels, but even if not many cases have been reported as of now in the states, it is not time to ease out. It's not time for people not to observe the lockdown because the numbers could rise exponentially. This is the one golden chance we have to fight this COVID-19, the outbreak of it, which is why it's extremely important for people to stay at home. Yet again, emphasizing on the fact that these numbers are what they are as of now, despite all the testing that has been done. So India has decided to increase the number of testing, and that's helped other countries as well in fighting COVID-19. We've seen what has happened in South Korea. The number of testing has been increased drastically, which has given the medical staff a better sense of how many people have been infected, which also gives a better medical facilities to those who have been infected. In India, the criticism we've received as of now is that enough tests are not being conducted. The tests are being increased. So the numbers could rise much more than what it is right now because more testing would be conducted. But that would also help the medical staff bring the situation under control, because once you know that these are the number of people who have been infected by COVID-19, they can be treated. As of now, if no testing is conducted, there could be people who probably don't even have symptoms. They could be the carriers, and this is the most deadly part of this virus, the COVID-19, the most deadly part of it being people might be infected, but they might not even be aware of it.